Hello, good evening.
Good evening.
Today we'll be doing motor system examination.
Okay.
So let's get started.
Observe the patient's position during movement and at rest. Watch for involuntary movements such as tremors, tics, chorea, or fasciculations. Inspect the size and contours of muscle. Do the muscle look flat or concave, suggesting loss of muscle bulk from atrophy or wasting? When inspecting for atrophy, pay particular attention to the hands, shoulders. Inspect the thenar and hypothenar eminences of the hands. Look for atrophy. Inspect for fasciculations. If absent, tap on the muscle with the reflex hammer which stimulates them. Muscle tone is best assessed by feeling the muscle's resistance to passive stretch. Hold one hand with yours and while supporting the elbow, flex and extend the patient's fingers, wrist and elbow and put the shoulder through a moderate range of motion. To assess muscle tone in the legs, support the patient's thigh with one hand, grasp the foot with the other and flex and extend the patient's knee and ankle on each side. Note the resistance to moving the limb. To assess the muscle strength, test the muscle strength by asking the patient to actively resist your movement. The patient's dominant side is usually slightly stronger than the non-dominant side, though differences can be hard to detect. Keep this difference in mind as you compare sides. Test flexion and extension at the elbow by having the patients pull and push against your hand. Test extension at the wrist by asking the patient to make a fist and resist as you press down. Ask the patient to squeeze two of your fingers as hard as possible and not let them go. Test both grips simultaneously to help compare the right hand grip with the left. Position the patient's finger with palm down and fingers spread. Instruct the patient to prevent you from moving any fingers as you try to force them together. Ask the patient to touch the tip of the little finger with the thumb against your resistance. Test flexion at the hip by placing your hand on the patient's mid-thigh and asking the patient to raise the leg against your hand. Test adduction at the hips. Place your hands firmly on the bed between the patient's knees. Ask the patient to bring both legs together. Test abduction at the hips. Place your hands firmly outside the patient's knees. Ask the patient to spread both legs against your hands. Test extension at the hips. Have the patient push the mid-posterior thigh down against your hand. Test extension at the knee. Support the knee in flexion and ask the patient to straighten the leg against your hand. The quadriceps is the strongest muscle in the body, so expect a forceful response. Test flexion at the knee. Position the patient's leg so that the knee is flexed with the foot resting on the bed. Tell the patient to keep the foot down as you try to straighten the leg. Test foot dorsiflexion and plantar flexion at the ankle by asking the patient to pull up and push down against your hand.